Welcome to RWJBarnabas Health's Health Talk Show. I am Dr. Douglas Oshinsky of RWJBarnabas Health Medical Group. It is estimated that 50 to 70 million Americans chronically suffer from some type of sleep disorder affecting their daily functioning, health, and longevity. The cumulative long-term effects of lack of sleep has been associated with a wide range of serious health problems, including hypertension, diabetes, obesity, depression, heart attack, and stroke. On today's show, we will learn more about common sleep disorders and how sleep is commonly linked to heart health. We are pleased to welcome Dr. Aesha Jobanputra, Medical Director of Robert Wood Johnson University Hospital, Somerset's Comprehensive Sleep Center, and Associate Professor, Division of Pulmonary and Critical Care Medicine at Rutgers Robert Wood Johnson Medical School, and Dr. Kameswari Maganti, Section Chief, Non-Invasive Cardiology and Director of Echocardiography Laboratory, Robert Wood Johnson University Hospital, and Professor in the Division of Cardiovascular Disease, Department of Medicine, Rutgers Robert Wood Johnson Medical School. Welcome to the show. Thank you both for being here on the show. First, for the studio audience as well as the people watching on TV, can you tell us a little bit about your background, who you are, where you went to, and what you're doing over at Robert Wood Johnson University Hospital?
Sure. So I'll go first. Good morning, everyone, and thank you, Dr. Oshinsky, for the kind invitation to speak today. And my name is Aesha Jobanputra. I'm a triple boarded physician in pulmonary, critical care, and sleep medicine, which basically means that I help people breathe, rest, and survive their toughest days. I've spent my entire academic and medical journey here in New Jersey, starting with undergrad degree in neuroscience and cell biology in New Brunswick at Rutgers, followed by medical school and internal medicine at Rutgers, New Jersey Medical School, completed my pulmonary and critical care fellowship also at Rutgers, but Robert Wood Johnson in New Brunswick. I did go away for a year from New Jersey. I went to UPenn for my sleep training. I currently practice all three specialties: pulmonary, critical care, and sleep medicine. I do inpatient services at University Hospital in New Brunswick. And my outpatient practice is primarily sleep, where I, focus on helping people get better sleep that leads to better health. And that's my background.
Well, thank you, everybody, for having me. I'm Kamu Maganti. I'm the Section Chief of Non-Invasive Cardiology, and I'm also Director of the Echo Lab. So as an imager and as a non-invasive cardiologist, we get to see a lot of patients who have multitude of comorbidities, cardiac comorbidities. So I feel that today's topic is really important for us to be able to address why sleep is so important. Coming to my background and training, I did my residency in internal medicine at University of Chicago. Then I did my cardiology fellowship at University of Nebraska. And then I did my advanced imaging fellowship, which is 2 years of looking at all the advanced imaging technologies when it comes to cardiology at Northwestern. I stayed on as faculty at Northwestern for almost 21 and a half years. A couple of years ago, I have come here to assume the role of Section Chief of Non-Invasive and to also shape the academic cardiology program here. So that's a little bit about me. And once again, thank you, and I look forward to this interview.
You're welcome. Thank you both for being here. And it's interesting, you didn't pick up any Chicago accent while you were out there for so long. So as an internist, I have a lot of elderly patients. And one of the prime reasons why a lot of them come into my office is sleep. then they have sleep disorders. So can you, each one of you, define what sleep disorder is and what the most common sleep disorders are?
So, sleep disorder is basically anything that interferes with your sleep, whether it's to getting good quality of sleep or getting sufficient quantity of sleep, or even timing of your sleep. And these issues don't just affect your nights, like when you're sleeping, but they also kind of seep into your daytime. They interfere with your daytime functioning. And some of the most common sleep disorders that we come across are things like insomnia or trouble falling asleep, staying asleep, waking up early, obstructive sleep apnea, restless leg syndrome, and things like narcolepsy and parasomnias as well, where you act out your dreams.
The reason cardiologists get very interested in sleep is because sleep disorders are very tightly tied to a lot of cardiac comorbidities such as hypertension, atrial fibrillation, pulmonary hypertension, and also coronary atherosclerosis. So these days, ever since ACCHA first guidelines have come out in 2008 about sleep, we started asking our patients a lot more about the quality of sleep and whether they feel rested or not after having a good night's sleep. And I always tell them a good sleep is equivalent to good health. So if people don't have proper sleep, they are likely going to be dealing with a lot of cardiac comorbidities. And I also tell them a third of your life is spent sleeping. You better have like really good quality of sleep. Similar to what Dr. Jobanputra alluded to, one of the biggest things that we focus a lot on is sleep apnea, because sleep apnea directly is tied to so many of the cardiac conditions. And of course, there is insomnia, sleep disordered breathing, restless leg syndrome that Dr. Jobanputra mentioned, parasomnia, circadian sleep disorders, and sleep-related multiple movement disorders, restless legs being just one of the many. Typically, once I get a history from a patient that they have some type of sleep disorder, I typically send them to sleep clinic because I think that is the way to get them evaluated, especially with increasing obesity, with increasing hypertension, diabetes, atherosclerosis. That is the right way to go.
So again, you described the fact that sleep disorders affect your health totally overall. And you talked about the fact that hypertension, and again, one of the first times when was someone who's overweight comes into my office in their 30s, and we notice that their blood pressure is suddenly going up. One of the things we have to suspect is not only high blood pressure itself, but if they are bigger and we see the neck area may be bigger, that they may have sleep apnea. So not only am I going to treat the high blood pressure, not only am I going to send them to the cardiologist, but I may also send them to the sleep specialist so that we can decide on sleep, if they have a sleep disorder, any sleep apnea, and whether or not they need any help at night. So can you describe to us again what happens in your body when we have a sleep disorder?
So sleep disorders, so I think we're specifically talking about sleep apnea here, obstructive sleep apnea, what happens to your body. So, normally we all have a breathing tube, right? It connects the back of our nose and mouth. Your upper airway goes all the way down to your lungs, and that's how it provides oxygen to the rest of your body, which is essential for us to leave. But when somebody goes to sleep, depending on their facial structure, depending on their obesity, if they are obese, their weight, these they tend to be more collapsible because there's also weight on it as they're sleeping, lying supine. And at the same time, depending on what stage of sleep they are, the muscles that were actually keeping the upper airway open may be completely relaxed if they're in their deep sleep. Or they may be completely paralyzed if they're in their REM sleep. So the airway collapses. And now the patient is not getting any air. They're not getting any oxygen to the rest of your body. So the brain realizes and says, hey, you got to wake up. So you end up having multiple arousals. And sometimes I've seen patients, a lot of patients I've seen, that have these arousals like 100 times an hour or even more. And so you can imagine if you're having these micro arousals where your brain is getting activated to activate those muscles, they're not getting much rest. And this has really, terrible impact on the rest of your body. It's almost as if, your body is fighting a boxing match throughout the night trying to stay awake. And so, people will feel very tired in the morning. The rest of the organs are also affected because the adrenaline levels have been high throughout the night when it should really be low and they should be resting. So there is no reset for the body. And this leads to a lot of the health conditions that you mentioned. So things like cardiovascular disease, strokes, heart attacks, atrial fibrillation, or irregular heartbeat. It can impact your liver. It can make you get into car accidents, which can make it very unsafe for a lot of people. So, it's a disorder that's overlooked, and it can have a large impact on your overall health.
And a big impact is also the fact that, like you said, their body, the brain is telling the person that they've got to take a breath, and they snore. And that's one of the big things that the partner will tell them, that they're snoring and that they can't sleep with them because they snore all of the night.
Yeah, that's one of the biggest reasons why people go sleep in separate bedrooms. The partners can't sleep because, the other partner is snoring so loudly.
And again, like you described, since they're constantly waking up, they're not getting the 45 minutes to get into REM sleep, which is the most important sleep for them to get into.
Correct. Yeah. And it's very broken up. And sleep apnea tends to be more, obstructive sleep apnea tends to be more severe during REM sleep.
So the lack of sleep specifically, how does it impact the heart cardiac health?
So, similar to the mechanisms that Dr. Jobanputra alluded to, with intermittent times of not having adequate amount of oxygen, there is going to be cyclic arousals. And what that does is it poses to be creating an oxidative stress as well as endothelial dysfunction. So typically during nice restful sleep, the parasympathetic activity, which means the body's heart rate is going to go down, the blood pressure is going to go down, the ventilation, the metabolism, everything is going to go down. And there is going to be cardiovascular quiescence. All of that is interrupted now. So instead, there is going to be sympathetic activity, which increases the blood pressure and the heart rate every time there is hypoxia and there is cyclic arousals. All of these adaptive mechanisms, since these are interrupted, there is going to be increased cardiac workload. There's going to be increased oxidative stress. There is going to be endothelial dysfunction, which means the lining of the vessels that actually produces nitric oxide to keep these vessels nice and fluffy and big, it is all interrupted. All of these lead to a lot of issues. So there is going to be left ventricular hypertrophy, which means it's an adaptive mechanism for the body to adapt to when it is seeing higher blood pressure, because the heart now has to work extra hard. There's going to be atherosclerosis. So all these vessels that are now, instead of happily relaxing when a person is asleep, when they keep having contractile dysfunction constantly, this leads to interruption of this nitric oxide synthase, and that actually leads to atherosclerosis and promotes atherosclerosis, so increased incidence of heart attacks that can be seen. And then whenever there is hypoxia, so there is decreased oxygen within the body, that can lead to abnormal heart rhythms such as ventricular tachycardia that can actually kill people, PVCs that are more often seen, and also atrial fibrillation, which is one of the biggest things we fight with as people do get older. Because, the atrial fibrillation is consistently, I should say, if you don't recognize it and you don't treat it, is associated with stroke. In addition to all of this cardiac stuff, there is also increased incidence of stroke and also mini strokes in this population. So it is really important, I feel, that we really diagnose people with sleep disorders and treat them appropriately.
Again, very important. The fact, again, atrial fibrillation is, of course, one of the most common irregular heart rhythms that we do have. And we do know that, especially if we're going in and out of atrial fibrillation, that's when we can throw a clot and cause a stroke. We go all the way back to George Bush when he was running outside the White House and went into the atrial fibrillation, had to be brought into Bethesda Hospital. And that's where we really heard a lot about atrial fibrillation, everyone around the country. So who is more susceptible for development of obstructive sleep apnea, men or women?
Typically, it is men. It is seen in about a third of the men and about a fifth of the women, almost 20% of women. But I'm sure Dr. Jobanputra may also have other statistics when it comes to these. Anybody who's obese, people who don't exercise, who's got a thick neck. But I leave it to you for some of the other things that you look for.
Yeah, so I mean, Dr. Maganti is absolutely correct. In middle age, midlife, men are more likely to have obstructive sleep apnea. And, big reason is hormonal differences between men and women. And in women, estrogen is actually protective until they hit menopause. So after menopause, what people don't realize that after menopause, the risk of sleep apnea is actually, in women, it increases and it becomes equal to that of men. So older men and women have similar risk of having obstructive sleep apnea. And again, likely because of estrogen and progesterone, because these hormones keep the airway more stable and they tend to decline post-menopause. So that's why it becomes equal in later life.
So I've got someone who I suspect has obstructive sleep apnea. So I'm going to send them over to you. Tell me what happens and what they should what they should be looking to do and to have done.
Sure. So you identified the first step absolutely correctly. So speak with your doctor and send them to a sleep specialist or consult about further testing that might be needed. So when somebody comes to see us in the sleep clinic, evaluated by sleep specialists, we review their medical history, we go over their symptoms, and then depending on their risk factors. So for example, if they have cardiopulmonary disease, they have hypoventilation that we suspect because of their body habitus. Depending on other risk factors as well, we would decide whether they need an in-lab sleep study, which is called a polysomnogram, or a home sleep apnea test, which has been approved. And I know we alluded to this earlier, home sleep apnea test, which has been approved to diagnose obstructive sleep apnea at home. Now, the in-lab sleep study, you spend a night in a private hotel-like room. In fact, where I trained, they had rented out a hotel-like floor where patients would go do the sleep study. And you take everything that you need with you when you were sleeping at a hotel. And they will place small sensors attached to wires on head and over the body to monitor things like brain waves or EEG, the breathing pattern and oxygen levels, your heart rate, and also your muscle activity. So they have a few EMG leads as well. It is painless, it's non-invasive, though it can be challenging because, like we mentioned earlier, you're sleeping in a different environment. It's not really natural to sleep with all these wires attached to you, but most people get through it without any issues. A home sleep study is simpler, usually focuses only on breathing and oxygen levels to diagnose obstructive sleep apnea. And it's a great option for many people because it's done in your own bed. You sleep in your own bed. The equipment is pretty easy to use. In fact, one of the devices that is out there is basically a little square piece like this that goes on your finger, and that's all. So there is multiple different devices out there. And once we have the results from these devices, we review them with our patients, come up with a personalized treatment plan. And again, getting tested can be scary, but it's really the first step towards getting better sleep if you are having sleep issues. And again, overall, for better cardiovascular health and better health in general.
And tell us what the CPAP is, continuous positive airway pressure, and what are the benefits and any negative side effects of it?
Sure. So, there's multiple different treatment options available to treat sleep apnea depending on the severity. And CPAP is one of those options. So, like you mentioned, it's a continuous positive airway pressure therapy, and it's recommended to treat moderate or severe obstructive sleep apnea. The way it works is earlier I mentioned if you have obstructive sleep apnea, it's the upper airway that collapses. And the goal of the CPAP therapy is to keep that upper airway open. It almost works as a small air splint. It blows air through the mask into your upper airway and keeps it open. Now, the benefits are that it will dramatically improve obstructive sleep apnea because it is not letting the airway collapse. So it can improve the sleep quality, reduce daytime sleepiness, and may lead to better control of other disorders that we've been talking about, things like hypertension, diabetes, and overall just help your mood improve. It can also prevent accidents from drowsy driving, which is a big issue, with obstructive sleep apnea. Many people also feel like they're more energized, more focused. Patients have described it to me like, I didn't know I could sleep like this. I feel like I was walking around with mental fog my entire life. And all of a sudden, I just feel better after using this. And once they get used to it, they can't really, they travel with it. They really don't want to sleep because they know how good the sleep is when they're sleeping with it. And, like any treatment, there can be some side effects. Generally, don't worry too much about it because it's not, CPAP is not medication. So there's no direct side effects. It's not even oxygen. It is just air pressure. It's the same air that you're breathing. You're getting into your airway with just a little bit higher pressure. But some people, because of the air pressure itself, some people do experience dryness, nasal congestion. You may have skin irritation from the mask itself. And overall, it just takes some getting used to. I explained to my patients that when I first started wearing eyeglasses, that was difficult for me to have that on my face, because all I could see was the frame itself. But once I got used to it, sometimes I don't even realize I'm wearing them and I'm looking around for them. So you can get used to it. And then in terms of the mask, if there are issues with the mask, there's like 200 different types of masks available in the market. So it's just a matter of finding the right one that the patient likes. And then there is also, it just once you get used to it, the benefits just outweigh the risk and the initial adjustment period.
Well, as someone who has people in their family who have the sleep apnea devices, first, the travel is very easy. It's in a little case, and it's very easy to use. Many of them come moisturized, so it makes it easier to breathe. And there's so many different masks that that can be fit to them correctly that it's really well worth it to really consider it if necessary. It's not like the old one, which used to be out like this and made so much noise that the bed partner couldn't even stay in the same room anymore.
Yeah.
So
sometimes patients tell me they don't even know it's on. It's so quiet now. Like the device has really gotten better. And like you said, humidifier chamber is built in, so it can provide humidified air. You just adjust it.
Other types of treatments available for obstructive sleep apnea?
Yeah, so it really depends on the sleep study and the type of sleep apnea you have. So specifically patients who have mild sleep apnea and don't have other comorbid conditions, there are second line things that are recommended. There is a thing, it's a custom made mouth guard. It's called a mandibular advancement device, which would be custom made by a dentist, sleep dentist. And the way it works is it's like a mouth guard that, the football players wear, but it's custom made to kind of move your jaw and tongue forward to help the upper airway open. If, for instance, patient has positional sleep apnea, meaning they're having a lot more breathing pauses, sleeping on their back compared to their side, then positional therapy can be recommended. There are a lot of devices available. They're all, none of them, unfortunately, are covered through the insurance, though. There is also, surgical options, which we often refer to our ENT colleagues. A lot of patients, yeah. and different types of, and also there is a reason that a lot of people may have noticed watching television, something called hypoglossal nerve stimulation. So depending on, if they meet the criteria, that could be an option. It's basically a pacemaker type of device. It's implanted, and it controls the nerve that controls the upper airway muscles. So they stimulate those muscles to keep the upper airway open. And most recently, in December 2024, there was approval of medication called tirzepatide to treat obstructive sleep apnea, and the medication is also cardioprotective. So it's been approved to treat moderate to severe sleep apnea in somebody who is obese. It's an injectable once-a-weekly medication as well.
Just so that the audience knows, that's the GLP-1 medications that people hear about, Ozempic being one of the ones that actually did do the studies for it and is getting not only studies and approval for sleep apnea, but also for cardiovascular reduction, as well as chronic renal disease reduction, in addition to weight loss and improvement in diabetic hemoglobin A1C treatment. Again, like everything else, we treat the risk factors in cardiac disease. We treat the risk factors. It improves their lifespan and improves their life tremendously, correct?
Yeah.
So what
definitely.
The audience should, what do you want to leave them with? What do you want to tell them to do, in order to reduce sleep apnea as well as the cardiovascular disease that is associated either with sleep apnea or without sleep apnea?
So first and foremost, I think the risk factors need to be clearly looked at. If somebody is having resistant blood pressure, in addition to taking the medications that have been prescribed for the hypertension treatment, along with daily exercise, people need to look in to see whether there is obviously any sleep apnea or any other sleep disturbance that may be contributing to the blood pressure. So if one has resistant hypertension, that is something that we typically recommend our patients to do. The second thing is if somebody has newly diagnosed atrial fibrillation or have atrial fibrillation that is really difficult to control. We do know from multiple randomized controlled studies that about 50% of patients with atrial fibrillation have sleep apnea. So that is, again, something we typically ask our patients to undergo a sleep study. If there is class 1 indication, if somebody has pulmonary hypertension, if their mean arterial pressure is more than 25 millimeters mercury, they obviously need to undergo a sleep study. Similarly, if somebody's having nocturnal angina or they have had heart attack when they are asleep, or they are having their defibrillator that fires when they're asleep, we typically once again ask them to undergo a sleep study. But overall, it is going to be multiple things that we are going to ask our patients to do. Eat right, sleep well, exercise, maintain a good weight for you, avoid caffeine and smoking, especially closer to bed, avoid working out closer to bedtime. Understand sleep hygiene, work with patterns that work best for you, make sure that you sleep in the same bed and try to maintain 7 to 9 hours of sleep because that has been shown to be directly tied to cardiovascular health. And also, if they have monitors available to them, such as Oura Ring, it's always good for the patients to also keep an eye on their own health. So we have to empower them as well.
Thank you both. Unfortunately, I'm running out of time right now. I'd love to have you back at another time where we can continue this because you both are really good at this and the audience would love to have more information, but unfortunately I've run out of time. So thank you both for being here. Thank you for what you've done for our community. Thank you for everything that you do for RWJ University Hospital. Thank you also for what you do at the medical school also.
Thank you so much. Thank you for having us.
That concludes today's episode of Health Talk. Please remember that the opinions expressed here today by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call us at 888-724-7123. For more information about RWJUH Somerset's Sleep Center, please visit www.rwjbh.org/Somerset.